Did you know that congenital heart disease is one of the most common birth defects affecting over 13.3 million people globally? From tiny atrial septal defects to complex conditions, CHD impact not just the heart but entire lives, especially those of future parents. Understanding this disease is not just critical for those affected, it is a key step toward advancing medical science and improving outcomes for generations to come. At Evergrowth, our edge comes from understanding the science behind the disease, which complement our stock picking process. We specialize in investing in small companies driving cutting-edge innovation in congenital heart disease care, from genomic research and AI-driven diagnostics to revolutionary advances like bioprinting and CRISPR technology. These breakthroughs have the potential to change the lives of millions of people worldwide.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrowth Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to this week's Open Mic webinar. The topic for this week is on congenital heart disease, a devastating condition for the newborns, for the kids. This week we have the honor of listening to the presentation from our chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen, who is a board-certified cardiologist and also medical director of Baycare Medical Group, one of the largest hospital groups down in Florida.
Definition of congenital heart disease is a very complex issue, and this is a topic that no adult cardiologist really want to talk about because we're not really well trained in it and we're not really expert in it. We always end up referring to congenital heart disease specialists as soon as we see a patient. Prevalence in 2024 here, as we can see globally, estimate about over 13 million people live with congenital heart disease, and the incidence has increased significantly since 1990. And the reason of that is improved in medical care, improved in medical diagnosis, allow those patients to live longer and live into adulthood. And the incidence about 9.5 occurs every 1,000 live births. Asia has the highest rates and Africa has the lowest. The leading cause of infant mortality, unfortunately, is congenital heart disease. Every year, we have about 250,000 to 300,000 infant mortality every year from congenital heart disease. Etiology, we have variety of etiologies. Main one will be genetic factors, but we also can have maternal infections such as rubella cases, and then we can have exposure to medication or toxin during pregnancy. This tends to occur in the older generations when a lot of us not really aware of the side effects of certain medications such as antibiotic, such as birth control medication that can cause congenital anomaly to develop. Of course, diabetes can affect the mother and result in damage to the infant as well. Type of congenital heart disease, we have septal defects that can occur as hole in between the heart chambers, whether it's upper chamber of the atrium or can be ventricle chambers. We also have valvular defects. We have malformation of the valve, result in the valve not opening well. We call that stenosis, and can result in the valve become redundant, result in regurgitation. We can also have malformation of the heart chambers. So the heart chamber can be formed not well, so it's not well fully developed, or can have form of heart chamber being too well developed, result in significant dilatation. And then in significant case of congenital heart disease, such as tetralogy of Fallot, referring to 4 heart defects in one, we have ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. And then we also can have transposition of the great arteries where the aorta and pulmonary artery are switched We also can have abnormal the blood vessel leading from the heart, result such as we call coarctation of the aorta, from narrowing of the aorta leading to decreased blood supply to the body. And then we can also have patent ductus arteriosus, which is the failure of the ductus arteriosus to close after both types of congenital heart disease. As we mentioned earlier, whole of the heart, either the septum or the ventricle. And the brief cartoon of the congenital heart defects here, as we can see, we have normal heart, and then we have ventricular septal defect, tetralogy of Fallot, hypoplastic left ventricular heart syndrome, coarctation of the aorta. Symptoms vary from severity of the defect. Can be cyanosis, result in blue babies, or we can have the baby have difficulty breathing, not eating well, slow growth. Effects on the body when we observe them can be heart murmur, clubbing of fingers. The reduced oxygenation result in congestive heart failures and pulmonary hypertension. Increased workload on the heart can cause the infants to be fatigued, poor growth, and this summarize of those signs and symptoms there. Diagnosis, we use fetal echocardiogram, and then postnatal echocardiogram, chest x-ray, EKG, cardiac catheterization, and now MRI. Treatments. In the past, we used traditional treatment like diuretic, ACE inhibitor, beta blocker for heart failure symptom. But to really treat this condition, most of the congenital heart condition have to have surgical interventions. Some of the condition can be outgrown as the patient get older. However, most of them end up really needing surgical intervention and may need to have close monitoring and subsequently additional surgical intervention, either by open surgery or transcatheter procedures. Outcome, many nowadays can live into adulthood and function normally. However, the prognosis based on the complexity of the defect and also the patient compliance in following up with their healthcare provider to provide close monitoring. New trends and facts, genomic research to identify genetic variants and allow us to personalize the medical treatment or evaluation of the patient. AI in the diagnostic, the use of machine learning to provide us more accurate diagnosis and risk stratification for future couple or future embryo being formed. Bioprinting can print out heart valve tissue and allow patient to be having a valve available for repair or replacement when needed. CRISPR technology, as you know, this is techniques that we discussed before using to correct the genetic defects that result in congenital heart condition. Wearable technology, now we can have remote telemetry data that can go home with the infant and allow the healthcare provider to remotely monitor the infant process and how they're doing at home. Ways to improve, research continue into genetic basis for congenital heart disease in order to provide target therapies. Technology allow us to provide more precise early diagnosis and also allow us to hopefully prevent invasive surgical procedures. Data sharing, international registry, allows to recognize certain area of toxins that can cause congenital heart disease, for example, certain medication that can be toxic to the mother and the infant, allow us to prevent those from happening. New medication, we have a lot of research into gene therapy, but we also have new drugs like we talked about last week using endothelin receptor antagonist. Bosentan has been approved by FDA for treatment of pulmonary hypertension from congenital heart disease, and that's made by Johnson & Johnson. And this is one example I mentioned earlier. Large cap company can be mentioned and allow us to provide more education to our population to be aware of the congenital heart condition, for example, using this type of treatment.
If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us, we'll schedule a call to see if we are the right fit for each other.